again with Dr. Nario for our weekly interview series. Dr. Nario, as you know, if you watched any of these, is with Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. They do a lot of what I think are just really cool treatments, from all kinds of vitamin bags and different drips and stuff for all different things. So if you want to know more, you can check them out online. It's Biointegrative Health Center in Reno, Nevada. If you have questions, put them in the comments section about any of these topics, and we'll try to get to them. I can usually let the doctor know that there's a question there. If you want to reach out to me, you can get me at stevemain.com for any reason. So, welcome, doctor.
Hi, Steve. Glad to be back. Thank you for inviting me again.
So let's talk about diabetes. Diabetes is a bad thing, and it's more common. And a lot of, we'll get into symptoms and so on, but it's something that a lot of people don't even know they have. They don't know that they're pre-diabetic. They don't know they're insulin resistant, all these different things. So tell us, what is type 2 diabetes?
Well, Steve, type 2 diabetes is always correlated with the term insulin resistance. And why is that? Because insulin resistance is one of the hearts, I guess, of the pathology of this condition. And again, this happens usually when we are adults, not as children. I mean, most commonly. And that's why when it happens in the younger age, it's type 1 when that occurs. Here, the cells of our body fails to respond to insulin, meaning the receptor actually is getting blocked and not letting glucose to get inside the cell to produce energy. And the reason for that is because we have what we call tired and lazy pancreas. Pancreas are the ones that creates insulin for us, and they're basically like on strike, like let's say the Amazon workers who feels underappreciated. And because of this lack of insulin production, maybe it is contributed through genetics, bad diet, overweight, and lack of exercise. Now the cell does not have energy to use. And fact check for everybody, currently estimated almost 300 to 400 million people are affected by this condition. And again, diabetes 2 versus diabetes 1 is more common.
Diabetes 2 is more common, right?
More common.
Yeah, because for sure, diabetes 1 is not self-induced. Would you say that type 2 is usually self-induced?
Most of the time. But you'll be surprised. Now there's a new pathology of type 2 turning into type 1, meaning now you're creating your own antibodies towards your pancreas, or the islet cells, as we call it, or the beta cells. And that's why, again, as you can see how the mutation of this condition now is happening. Before we didn't have this. This is how bad the world is going into in terms of what environment, toxicology that we're encountering every day. We're mutating disease that was stable for like years before.
Wow. Yeah. And it's like, I'm not the doctor, but I think type 1 diabetes is you're not producing insulin. Right. Okay. And now we're seeing type 2, because that's not the problem. They produce insulin. They're just resistant. But now we're seeing a conversion from 2 to 1.
Yes, that's correct. I have them here in the clinic as patients. So very challenging to treat, but they're doable.
Okay, so there's really most people aren't going to know for sure, wouldn't you say, if they're pre-diabetic? But is there any symptom? Is there any way? I mean, I kind of know. I'm a fitness professional. I've been in the business. I can simply look at ankles and midsection and skin and pretty much guess, hey, you might, if you don't know that you're diabetes, you might want to check that out. I can even do that. But can the average person recognize, hey, I might have diabetes, And if they can, what are the symptoms? Are there symptoms?
Well, Steve, yes. I mean, pretty easy, but not so easy. But the thing here is we have to remember insulin resistance is the heart of this condition, meaning, again, uh, blocking those cell receptors from not letting glucose in. And what's blocking them? Fatty acids, excessive glucose, toxins, heavy metals, and more to be known about that. And it's still, again, they're investigating more on this. And when you're not getting insulin in the cell, of course, glucose builds up in the blood, leading to inflammation, fat accumulation, and thus the pathology of diabetes occurs. But there are three symptoms that you can definitely figure out in relation to diabetes. The three P's of diabetes, we call them, and number one would be polyuria, meaning you're urinating a lot. Why is that? When you have a lot of sugar in your body and it goes to your urine, it's actually acting like a sponge, meaning absorbing a lot of fluid out of your system and compartments to let it through the urine. So you're basically getting dehydrated as you pee, and now leads to polydipsia, meaning thirst. Because of that loss of fluid, now you're drinking a lot of water. You just want to replace it as if you're like having a heat stroke. And then lastly, polyphagia, meaning you're so hungry. Why is that? Because as I told you a while ago, cells cannot use the glucose or sugar in your system. And that's why all these cells are, oh, I want to eat, I want to eat. Let me put some more energy sources in my body. But even though you put it in, it's not going to get used.
Wow, that's interesting. So people are hungry even though their glucose levels are high
Mhm.
because the cell is not absorbing and able to use the glucose. So your body thinks you're hungry when you really don't need food. You need to fix this insulin glucose problem. Is that right?
Right. It's like a lock and key. You don't have the key to get in through the door, but you're outside, you're waiting, you want to go in, and all the people who's ready to go through that door is like lining up.
Okay, so tell us about blood work. What do you look for if you're suspicious that somebody might be a diabetic? What are the blood markers? What kind of tests do you have them do, and um, what are you looking for?
Well, see, again, this is something that is a disease of centuries past. Even during the caveman days, they have a way to determine if you have diabetes or not. How? People urinate on the ground. Yeah, and then let it sit for a few minutes, and you will see ants piling up on your pee, calling it sweet pea, due to the sugar content that it has. But again, if you don't have any insurance, please don't do this. Don't taste your pee just to know if you have diabetes or not. Testing is very cheap. But my point there is it's a disease again of way back when we were during even our ancestors. But presently, the American Diabetes Association has our common methods to abide to. One is hemoglobin A1C. You can ask this from your doctor, and it shows or reflects your 2 to 3 month status of your sugar load of the system. 6.5 or higher can actually be diagnostic for diabetes, and fasting glucose. So diabetics, you would see this on the LabCorp or Quest range 126 or higher. And this is the one that we do through the finger stick. I like it around 80 to 90. I want it lower because the risks are less when you're in those ranges. And a more subtle test would be insulin. So when you get insulin, and that's what your pancreas create, and if you have high, you know that the pancreas is like, man, I'm overworking. There's a lot of glucose here that I need to push in. And again, this is a preview that now the cell is getting more resistant and not letting glucose inside.
Okay, so last question: is there anything that we can do to treat this naturally? I know the answer is yes, with diet, exercise, or whatever.
Right.
Um, but what advice would you give to someone with their diet, or what should they do if they're pre-diabetic or they're on that, you know, borderline? What would you do? What would you recommend?
Well, Steve, number one, for everybody out there, mindset. It's always about mindset. People think, oh my God, I have diabetes too. It's my family tree, genetics. I'm doomed to have this. Really? No, you're not doomed to have it. Very reversible. I have a lot of patients who've gone through it and actually have enjoyed the fruits of their labor. The thing here is the one that I can add in there is detoxification. When I talk about receptors that we need to clean, remember they're blocked. That's why they can't get in the cell. We have to remember all these possible blockages: excess sugar, the fats, the toxins in our system. That's why we need to clean these byproducts up, and we need to facilitate excretion through organs of drainage, such as the kidney, the liver, and also the colon. So everything needs to grow to get out. That's why we have interventions of like we give IVs to get yourself alkalinized, liver detox. We have chelation therapy, oxidation therapy. All of these things are actually things that we do. But of course, as we all know, the best treatment would be prevention. Nothing beats that. But if our viewers, if I can leave something to them that they can start with already, I'll give you three most popular supplements for this condition. One is cinnamon, not cinnabon, but cinnamon. So it's a tropical evergreen tree, inner bark, one of the oldest spices in the world, increasing responses of tissues to insulin. Unless, of course, you want to bite on a quill and lose all your teeth, you definitely want to just use the powder. And 1/4 to 1 full teaspoon per day, or 500 milligrams in a capsule twice a day would be enough. Number two, ginseng. Found ginseng, whatever you want to call it. It's found in mountains of Manchuria, China. Don't go to China. We can buy it here in our supplement stores. And there are so many multiple uses for it: adaptogens, aphrodisiacs, stimulants, but it increases the insulin sensitivity and secretion of our pancreatic cells. So 3 grams per dose. And lastly, alpha lipoic acid. Very potent antioxidant. It improves insulin sensitivity to tissues and helps with neuropathies. And if you want the antioxidant dose, 20 to 50 milligrams per day. And if you want to address diabetic neuropathies or the numbness and tingling of feet for a diabetic, around 800 milligrams per day in divided doses.
Yeah, and I know you do a lot of IVs there. ALA is one that you do.
Mm-hmm.
And ALA, I've done that vitamin or that drip about 4 or 5 times, so I know that's a good one.
Mm-hmm.
And you've mentioned some of the other ones: chelation, liver cleanse, and
Yeah.
so on, to detox. So detox is a good first start, but again, correct me if I'm wrong. If you don't change your lifestyle, nothing's. I mean, that's a band-aid. If you don't change your lifestyle, right?
That is correct. One of the bigger challenging. So everything I mentioned would be something to take in. But if you're actually reconstructing the foundations of your life, that's going to be one of the bigger challenges that I experience with my patients.
Yeah, exercise and diet, that's critical. Okay, well, thanks for being with us, Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thanks for being with us.
Well, thank you, Steve, for having me. As we all know, knowledge is power, and thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.